Well-being. Being well. Shame. Shame is a complex, self-conscious emotion that arises when individuals perceive themselves as flawed, inadequate, or exposed in relation to personal or social standards. Unlike guilt, which is typically focused on specific behaviors, shame involves a global negative evaluation of the self. When persistent or unprocessed, shame can significantly affect psychological well-being, interpersonal functioning, and physical health. Psychologically, shame is often triggered by internal perceptions of failing to meet personal values or external experiences such as criticism, rejection, or humiliation. These triggers activate cognitive appraisal processes in which individuals evaluate themselves against perceived standards of others. This appraisal frequently results in a negative self-view characterized by feelings of inferiority, defectiveness, or unworthiness. Emotionally, shame is experienced as deep discomfort, embarrassment, or distress, often accompanied by an intense fear of judgment or social rejection. Behaviorally, shame commonly leads to withdrawal and avoidance. Individuals may disengage from social interaction to reduce perceived exposure or attempt to avoid situations that could trigger similar feelings in the future. In some cases, shame may also manifest as defensive behaviors, such as denial, minimization, or externalization of blame, as a means of protecting the self from further emotional pain. Physiologically, shame activates the autonomic nervous system in a manner similar to other threat-related emotions. Sympathetic nervous system arousal may produce physical symptoms such as increased heart rate, muscle tension, sweating, and blushing due to increased blood flow to the face. The release of stress hormones, particularly cortisol, contributes to heightened physiological stress and, when chronic, may negatively affect immune function, cardiovascular health, and overall physical resilience. Characteristic nonverbal expressions of shame, including downcast gaze, slumped posture, or covering the face, reflect an embodied desire to reduce visibility and perceived social threat. Neurologically, shame involves coordinated activity across multiple brain regions associated with emotional processing, self-evaluation, and social monitoring. The amygdala plays a key role in detecting social threat and amplifying emotional arousal. The medial prefrontal cortex is involved in self-referential thinking and evaluation of social implications, contributing to heightened self-focus during shame experiences. The insula supports awareness of bodily sensations and emotional discomfort, while the anterior cingulate cortex monitors discrepancies between behavior and social norms, reinforcing the emotional response. Reduced activity in reward-related regions such as the ventral striatum may contribute to demotivation and diminished self-worth commonly associated with shame. Psychological and physiological responses to shame interact through reinforcing feedback loops. Cognitive perceptions of defectiveness intensify physiological stress responses, which in turn amplify emotional distress. When shame becomes chronic, these processes may contribute to long-term difficulties such as low self-esteem, anxiety, depression, and altered neural connectivity associated with stress regulation and self-concept. Coping with shame involves strategies that promote emotional regulation, cognitive restructuring, and relational safety. Self-compassion is a central protective factor, as responding to oneself with kindness and understanding reduces self-criticism and interrupts shame-based narratives. Cognitive restructuring, often supported through therapeutic approaches such as cognitive behavioral therapy, helps individuals challenge and reframe distorted self-evaluations. Mindfulness practices support non-judgmental awareness of shame experiences, allowing emotions to be observed without escalation or avoidance. Social support further mitigates the impact of shame by reducing isolation and providing corrective relational experiences. Sharing shame-related experiences with trusted individuals can weaken secrecy and restore a sense of belonging. Understanding the neurobiological and psychological mechanisms underlying shame supports normalization of the experience and empowers individuals to engage in effective regulation strategies. Shame is a deeply human emotion rooted in social connection and self-awareness, but it need not define identity or worth. Through self-compassion, cognitive flexibility, supportive relationships, and emotional awareness, individuals can reduce the intensity and influence of shame and cultivate a more resilient, integrated sense of self that supports psychological well-being and long-term growth.